This is the Scholarlynk news for 30th December 2020. Singapore will start COVID-19 vaccination today for healthcare workers at the National Centre for Infectious Diseases. Healthcare workers from other healthcare institutions will begin vaccinations in the coming weeks. Seniors aged 70 and above will be next in line to get the vaccine from February of next year. Thereafter, the Ministry of Health will vaccinate Singaporeans and long-term residents who are eligible. Getting vaccinated will remain voluntary. Further, the Pfizer-BioNTech vaccine has been assessed to be suitable for those aged 16 years and above, but not for pregnant women. Other measures such as contact tracing and testing will continue to be used alongside vaccinations to stop any spread within the community. Singapore is moving into Phase 3 of its reopening. This includes increased capacity limits for attractions and allowing more people to gather and dine together, which brings with it the risk for more community spread. Think about it. What would be the reaction of the public if any government made getting vaccinated compulsory instead of voluntary? More health experts are warning patients who seek treatment in healthcare facilities against lying about their exposure to COVID-19. A doctor has shared on Facebook that she had tested positive for COVID-19 after being exposed to an infected patient who had hidden his history of illness during screening before taking a CT scan. The patient had been experiencing cough and fever for a week prior to taking the CT scan and was later confirmed to be COVID-19 positive. Patients who do not tell the truth about their history of exposure and contact and as a result infect healthcare workers will cause manpower shortages during the pandemic. Under Section 12 of the Prevention and Control of Infectious Disease Act 1988, lying to a government official which could lead to the potential spread of disease is considered a serious offense that can lead to a 2-year jail sentence. Think about it. It seems like in this climate, all patients will have to be treated as being COVID-19 positive until proven otherwise. Do you think formal charges should be brought against patients who lie about their potential infection status? For the first 2 weeks of 2021, Indonesia will close its borders to foreign travelers from all countries. This is due to the discovery of a more infectious coronavirus strain in the United Kingdom. The new B.1.1.7 strain may be more infectious, but has yet to show that it causes more severe illness or higher mortality. The new strain has already been detected in other European countries, Canada, Japan, Australia, and Singapore. Foreigners arriving in Indonesia before December 31st must follow strict health protocols such as presenting a negative polymerase chain reaction test taken at least 48 hours before their departure to Indonesia, another test taken upon their arrival to Indonesia, and being quarantined in designated hotels. Citizens returning from abroad would have to follow the same protocols, but their expenses would be paid for by the government. This is the second time that Indonesia is closing its borders as there continues to be a rise in the infection numbers. Think about it. Would stricter health protocols for people arriving in Indonesia be enough to protect the country? If so, is there still a need to close the borders? China's financial regulators have required Ant Group, the financial technology arm of e-commerce giant Alibaba, to rectify its major business lines. This is to comply with laws and regulations, to ensure fair market competition and protect consumers' interests. Regulators have also stated that Ant Group should return to focusing on their payment business and improve the transparency of transactions. Ant Group has announced that it accepted the requirements from regulators and will establish a special working group to proceed with rectifications. It has promised to do this without increasing the costs to customers nor lowering their standards. A vice governor of the People's Bank of China stressed that financial regulatory policies in the future will follow the principles of breaking monopolies and investigating unfair competition. There will be zero tolerance when it comes to matters of illegal acts or protecting property rights. China's top-level policymakers also wish to prevent disorderly capital expansion. Think about it. What do you think spurred financial regulators to look into Ant Group now? Is the sector growing too fast and in a disorderly manner? The World Health Organization's chief has stated that the coronavirus will not be our last pandemic. He also said that tackling climate change and animal welfare must be included when trying to improve human health, or the attempts will be doomed to failure. People must also learn to prepare for the next pandemic instead of the short-sighted practice of just throwing cash to try and stop outbreaks. In a first annual report on world readiness for health emergencies, published a few months before the outbreak of COVID-19, it was stated that our planet is very unprepared for potentially deadly pandemics. The coronavirus has killed more than 1.7 million people with more than 80 million infections. The WHO chief called on people to learn from the lessons of history that epidemics are a fact of our lives and to learn from this current pandemic that has highlighted the close links between the health of humans, animals, and our planet. Think about it. Can you draw the links between the health of humans, animals, and the threat of global warming? This brings us to the end of today's edition of the Scholarlynk News. Please remember to subscribe and click on the bell icon to be notified of our new videos. As always, this is the Scholarlynk team wishing you goodbye and have a wonderful rest of the day.